So digital social care records, often referred to by a lot of people in the sector as digital care plans, digital support plans. They are essentially a digitisation of all of the documentation that you might typically include in a care plan record folder, digitised so that we can reap all the benefits of digitisation.
So what are some of the benefits for care providers for going digital?
So along with the ease of actually documenting the information at the time of providing care, the transparency of information, the carrying information to other people across the sector and the awareness of the care that's being provided. There's also huge time-saving benefits in terms of the people providing care themselves, so that they're able to document the information that they need to document and then get back to the reason why they're in care in the first place, and that's to provide outstanding care to the people that they're there to support.
I think for me as well is I'm a regional business manager, and it's having the ability to check in on a service remotely. So anyway, I could do it from here today just to make sure, you know, the audits are being done, any actions follow through.
There's also a massive safety benefit as well, so being able to really record information about people's care needs in real time and being able to highlight potential risks, things like risk of dehydration and malnutrition, and medication errors and things of that nature, being able to pick up on those things and respond to them quickly and efficiently. So there's a big benefit to service user safety as well in using digital care records.
I think that's a really important point, but the other thing about them is that they're also creating a platform for the future. So as we see technology continuing to develop and evolve and see the impact that it can have in care delivery, we will need to plug a lot of the information that we're getting from some new technology into something so that we can actually make good use of the information that we're getting. So if we take as a really practical example, I think remote monitoring technologies people talk about quite a lot. What we don't really want is a situation where you have remote monitoring technology that's picking up information, it's then sending that to a central point that is then not actually coming through to you as a care provider. What you want it to do is just be presented as part of the information that's gathered for your care planning, as part of your care delivery, and then that's helping you to much more accurately look at things like the risk, as you said, and to start mapping rising levels of risk in the home as well, so that you can start to intervene slightly earlier and help to reduce people's care needs.
I think it's probably also important to layer on top this the view from the regulators. So we're very interested in assessing safety. We're very interested in assessing quality of care, and from our perspective, we're looking at ensuring that providers are focused on providing compassionate, safe, effective, high-quality, person-centred care, and good quality records underpin the ability for providers to be able to do that. And that's true for paper records, but it is so much more true for digital records, because some of the reasons that we've talked about already are, you know, that the power of digital solutions is so much more, you know, not just remote, the ability to look at it remotely, but the ability to aggregate data and use that in different ways, the ability not just to improve the experience for colleagues within care services, but also that ability for you to look at this from a management perspective and oversee and assess the quality of care and safety in an organisation.
Thank you very much. And from a CQC perspective, obviously you spoke about person-centred care. A lot of the digital systems now have the automated function, so it pre-populates statements. What would your advice be for providers that are using a system where it's pre-populating, so new one could be seen as taking away some of that person-centeredness, because it's obviously more of a generic response?
I mean, I think for us as the regulator, and we've put this in our recent updated guidance on good practice with digital care records, is that we would still fundamentally expect that providers have person-centered care records. So although there may be some aspects of, for example, you know, activities that have been done or medications have been given that could be done as a more efficient, you know, exercise in being able to record that, we would still expect for digital care records to follow the same principles that they would as paper care plans, that they should be person-centered, they should include information about what's important to that person. Ideally, it should be involving that person and those that are important to them in being able to gather that information. But there are certainly efficiencies that digital care records in the daily, you know, upkeep of people's needs and tracking of their needs that can add to it. So I think you can have both. You can have those efficiencies as well as having that person-centered care.
And I think it's also really important that we don't look at the digital care records and say, okay, that can pre-populate some of the data and therefore that's going to stop person-centered care. I think person-centred care is much more about the way in which the care provider operates than the technology they're using. And one of the things that we're always very mindful of in the work that we're doing is it's not about technology for technology's sake. It's about how is this helping people to deliver better care, better quality care, safer care, more efficient care.
Yeah, no, thank you very much. So, burning question from providers, from somebody from the CQC to answer, is will digital social care records become mandatory during inspections?
It isn't for us to mandate any particular requirements, but what I would say is, I mentioned about our single assessment framework. That's something that all providers will start to learn about over the course of the next few months. Part of that is a body of consistent quality statements that will apply to various different parts of the operation. Part of that will look at your ability to manage good quality care records. What we would certainly see over time is that it's likely to become increasingly difficult to maintain the levels of quality that other providers are achieving with digital social care records, and therefore it becoming increasingly difficult to maintain a good or outstanding rating if you have not made that move. You know, we talked about the support there's significant support available right now. I mean, our advice to providers is to take advantage of that support while it's available, while there's a momentum of people adopting digital social care records, while there's support, while there's funding available, while there are peer networks that are developed around this. Now is the time to do it and to take advantage of that. And you'll see the benefits, not just of using the systems, but the ability to be able to maintain and improve your standards of quality of care in the future.